There's a famous saying that you have executed something with the precision of the surgeon. I think now we get a new vocabulary. We now shall be talking of cyberknife precision. When I was listening to the experts, and they were able to tell us that the cyberknife is able to be as precise as a single human hair strand. That is, the laser can become as small as the human hair strand, one. Then that tells you that indeed technology shows us that Kenyans can achieve a lot if we are focused. If you can have that cyberknife precision, we can go places. Some of the diseases they talk about here are diseases that bankrupt families. First of all, you inflict the pain, the emotional pain, and then they inflict the financial pain. Many families have gone to ruin because either they have not been able to access this kind of medical service at an affordable cost, at a realistic cost, or alternatively because it's not there at all. So I think we all owe it to the team here to really congratulate them in taking this very bold step and making Kenya one of the first in this particular.
And I have had robust conversation with the counties on this particular subject, and especially on the very primary subject of promotive and preventive health. We have agreed with the counties, for example, that beginning next month, we're going to roll out our community health promoters initiative, where for the first time, we are going to equip them appropriately. And the government of Kenya, through the Ministry of Health, is working on the equipment to equip 100,000 community health promoters. And we are also going to work with them on their stipends so that every community health promoter in every locality will be responsible for 100 families. And it will be a requirement that every community health promoter, at least once in a month, they must visit every family, so that we begin the journey to diagnose, we begin the journey to understand the health of our communities, and also prevent unnecessary expenditure on illnesses that can be managed if they were discovered early. We are also working on how to reform the entire chain so that we can also devolve resources, devolve decision-making, and also bring on board all the partners that we have. All our procurement facilities, as I have said here, apart from technology, we are also going to bring on board other stakeholders. We're going to bring on board those partners who help us with the delivery of health, whether they be non-governmental organizations, private hospitals, public themselves to participate. And we have agreed with the counties that they are now working with us on the 315 community primary care networks, 315 primary care networks that are that actually cover every part of Kenya to ensure that we keep tabs on matters health as close to the citizen as is possible, and that decisions will be made at that level on procurement, on service delivery, and we can also give an account of what health looks like in every locality.
Your Excellency, as you are aware, the disease burden due to NCDs is not just a Kenyan challenge, but a global challenge. And Your Excellency, this institution is our National Center of Excellency for Management of Oncology. And I want to thank Your Excellency that through your guidance, this institution has lived to its expectations. That besides launching the cyberknife, which is at the end of the continuum of care for oncology, it also has a PET scan that does diagnosis of cancer. And Your Excellency, they have continued to provide expertise to the 10 regional cancer centers that we have within the country. Your Excellency, I'm happy that besides them being able to take care of cancer, they are also providing care and expertise to the other centers through the hub and spoke model. And I am aware, Your Excellency, that this institution has already signed MOUs with our different cancer centers, and they're able to provide that expertise. Your Excellency, having said that, this institution as well is giving us what we asked for in our plan of Kenya Kwanza on matters universal health coverage. That besides providing service, they are also a teaching institution. And Your Excellency, they are teaching specialized nurses, as we have had during the tour. And besides that, they are also providing a collegiate training for medical doctors in surgery, in anesthesia, and internal medicine. Thank you very much. So Your Excellency, they are living to our expectations. And besides that, Your Excellency, I want to confirm to you that they are aligned with our universal health coverage program. And we are working together with them to ensure that there is access to care through the essential benefits package, Your Excellency, that we have developed with the NHIF, and through your guidance, the critical care fund that you have told us to ensure that it is in place to be able to be accessed by Kenyans who end up with critical conditions such as cancer. Your Excellency, we are on course, and we are happy indeed with your directive of changing how healthcare is managed in this country, that we are shifting healthcare from curative to preventive and promotive healthcare. Your Excellency, I would like to report to you that as a ministry, we are ready now in the next month to be able to launch the community health promoters. And Your Excellency, the 100 community health promoters that we are going to launch are the game changers in management of oncology. Our expectation, Your Excellency, is that these community health promoters will be able to go into households and therefore be able to do screening, early screening, and send the patients to hospitals and to centers of care. Your Excellency, that is a game changer. And globally, that is the direction that everyone is taking in management of oncology besides having this equipment.
Representative will ask for the support in coordination with the Minister of Health, and we will provide that support.
For the disease spreads further. The national and global statistics, which show that a one-stop shop for breast cancer, the genetic makeup of the patients, given that inevitable 1 billion shillings and options for cancer. For radiation therapy, the hospital has been for up to 3 to 4 months, which is detrimental to the team. For radiotherapy are already sick. And as for 2 bankers, and 1 banker is still without months. We will consequently save lives, reduce mortality for these people who are sick, testing, undertake the soft run nurses that are critical to proper management Your Excellency, sir, ladies and gentlemen, these hot patients, inpatients, and 800 outpatients, Your Excellency. The cyberknife is a timely addition. The PET CT and SPECT CT are imaging agents who go outside the country to seek early cancer. Your Excellency, the cyberknife is a variable addition to the continuum of conditions and tumors such as brain, described earlier, available in this public facility. Before I conclude, allow me to bring to your attention, audition was done, but we never got feeder, a clinical oncologist from India who is an expert in cyberknife services.
All guests, Professor, CS towards WHO, and enter into negotiation with the government. Let me say, I was very impressed with the engagement of the government. Which to this, there was also a commitment to complete the project in a timely manner. Been granted to WHO by the government of Excellency. We thank you very much. We thank the government into a contractual agreement with the